Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith Rogers. Today, federal policy changes on homelessness. Anne Oliva is the CEO of the National Alliance to End Homelessness. She speaks with Dr. Josh Sharfstein about the recent executive order issued by President Trump, what it means for people living on the streets, and how the VA has significantly reduced homelessness among veterans, and what comes next at the state and local levels. Let's listen.
Anne Oliva, thank you so much for joining me today on Public Health on Call to talk about this executive order on homelessness that President Trump signed at the end of July. How are you doing today?
Hi, Josh. Thank you so much for having me. I'm doing okay. A little concerned about a number of things that we're going to talk about, but we'll get into that in a minute.
I'm looking forward to it. But before we really get into it, could you introduce yourself to our audience as well as the National Alliance to End Homelessness that you run?
Sure. Again, my name is Anne Oliva. I am the CEO of the National Alliance to End Homelessness. We are a national, nonpartisan, nonprofit organization whose mission is really simple. It's to end homelessness in the United States. And we do that in 4 different ways. We have a public policy shop where we talk to public officials about what works. We run a research institute. We conduct strategic communications, and we do community-level capacity building.
So you work all over the country. And homelessness has been getting worse in the United States recently?
It has. Unsheltered homelessness has been going up every year since 2016. And over the last couple of years, we have seen pretty significant increases in the number of people experiencing homelessness. Just last year in 2024, saw an increase of 18% nationwide of people who were experiencing homelessness.
That is a huge increase. So attention from the federal government, in theory, could help with that problem. Tell me about what you were doing when you heard there was a new executive order on homelessness.
Yeah. Well, first, I would say absolutely attention from the federal government could be helpful if the federal government were to follow evidence-based practices, were to listen to experts and look at the research and make public policy accordingly. But that's not what's happening right now. What we're seeing is in this executive order, which I've been doing this work for more than 30 years, and I would say that this executive order is one of the most harmful proposals that I've seen in my entire career. And in part because while the individual components of this proposal are by themselves troubling, the cumulative effect of how it's going to impact very vulnerable people in this country is incredibly alarming.
Those are some strong words, so I'm
They are strong words.
eager to have you explain how you reach such a severe conclusion.
Yeah. So I don't use strong words lightly. I myself served in the federal government for 10 years. This is not language that I use under normal circumstances. So first, I want to just note that in the executive order, the rhetoric, the language that is used is incredibly reckless and dangerous. It dehumanizes people who are in some of the most vulnerable states, living in tents, suffering from health or behavioral health conditions. And it's applied to unsheltered people and people experiencing homelessness. So it sets a tone that is very dehumanizing. So that's sort of an overarching observation. It also aims to basically kill evidence-based approaches that we know work to end homelessness for people based on a huge amount of research and evidence that has been conducted over the last 20 or 30 years, including permanent supportive housing and an approach called Housing First that uses safe and affordable housing as the base by which to ensure that people can then address their health concerns, their behavioral health needs, their employment needs. So that is another piece of that.
Let me interrupt you for a quick
Please.
second. So your first point was that the language is very harsh about the people who are actually homeless. It starts endemic vagrancy, disorderly behavior, sudden confrontations, and violent attacks have made our cities unsafe. So it sets a very clearly negative tone in terms of the way that they're thinking about this challenge. How would you have framed something differently?
Well, I think, all you have to do is look at the National Alliance's website at endhomelessness.org, and you can see how we frame our work, which is person-centered. It treats people and talks about people with dignity and respect because we think that everybody deserves that level of treatment, not just from us, but from the federal government and from all of our partners who do this work on a daily basis. So that's all your readers have to do is go look at our website and you can see how we frame this work. We also do a lot of work with people who have experienced homelessness or are experiencing homelessness to get their input and to ensure that we're using language that works for them.
Because they don't see themselves as vagrants who are confronting people with violent attacks, just to point out the obvious.
That's right. Yes.
So your second point was about turning away from certain approaches. You mentioned permanent supportive housing and housing first. Can you explain to me a little bit about what those approaches are that this executive order rejects?
Sure. So the executive order specifically rejects housing first, which is an approach to addressing homelessness that basically says in order for anybody to feel safety and be able to address some of their underlying needs that could run the gamut from, childcare to mental health care, to substance use treatment, to employment services. In order to really successfully do that, you actually need a safe place to sleep. And once people have a sense of safety, they can address these other needs. So housing first is really just the basis that allows folks to meet their own life goals.
In place of housing first, and permanent housing, this executive order emphasizes temporary shelter and expecting people to have put those various things in order before they're getting other assistance. Is that the difference?
Yeah, that's right. It leans on sort of emergency shelter, transitional housing, which is usually up to 2 years, rather than addressing the underlying issue that is really the driver of homelessness, which is the severe lack of affordable housing for people at the lowest incomes in this country.
So those are your first 2 points. What other things were on your mind as you were reading this executive order?
Yeah, the other issue that sort of transcends the homeless services space and really, I think, has caused a lot of alarm across other sectors is the order calls for communities to make it easier to involuntarily commit people living with mental illness. So this is something that this country has tried before and that has not really worked. So it incentivizes states to, again, make it easier to institutionalize people against their will rather than providing the community-based treatment that people want and need. There are waiting lists for mental health services and substance use treatment and medical care that people just can't access. And they did this at the same time that they're making cuts in programs like Medicaid that provide these kinds of services for people with low incomes.
So if we're, for example, thinking about somebody who is living on the street, who can't find housing and has significant mental health concerns, the point you're making is better to support that person with community mental health services rather than put them in an institution for an indefinite period of time.
There are certainly in my own career, there have been times when an involuntary hold is necessary. But in my experience, in the vast majority of cases, involuntary holds don't actually solve the underlying problem, which is that folks don't have a safe and stable place to live and to address their mental health needs through community-based care. They can't access the care, and they certainly can't access the housing.
Now, in a way, did you feel that this executive order is rolling back the clock on homelessness efforts in this country?
I think you put your finger right on part of certainly my own reaction, my organization's reaction, is that this takes us back to the 50s, 60s, some of it to the 80s, where we tried these kinds of efforts and they didn't work. The reason that they didn't work is because it forced people into programs that weren't designed for them. It forced people into institutions that didn't actually address their underlying needs in the way that folks want. And it doesn't treat anybody that's subject to this EO with any sort of dignity or autonomy.
Now, somebody who may be tuning into this might say, have these other approaches really worked? We know that there was a big housing first effort in President Bush's administration. There have been investments in supportive housing, including through the Medicaid program. But here we are, like you said, with homelessness continuing to get worse. Why not try something radically different?
So I think what folks who are listening really need to know is that the evidence behind these permanent supportive housing for people with higher needs, behind rapid rehousing, which is a shorter term rental assistance with services attached to it, housing plus services works. It is one of the most studied interventions. And the problem that we have right now nationwide is that it's not funded to scale. And we know it works because it worked for veterans who are experiencing homelessness. The HUD-VASH program, which is a program that combines safe and affordable housing provided through the Department of Housing and Urban Development with services provided by VA medical centers. That has been the sort of keystone of the federal government's approach to reducing homelessness among veterans. And in fact, homelessness among veterans using this approach of housing plus services has decreased more than 50% since it was implemented. So when we have housing and services to scale, we know that we can reduce homelessness. But when we have this sort of combination of things that are happening right now, which is the affordable housing market is woefully inadequate, and we have these kinds of interventions not being funded to scale, we see what we have right now. And I think the argument that I've heard other folks make is that you just sort of alluded to, that, oh, well, it's not working, so we should try something else, is kind of like blaming the emergency room for people getting sick, right? That doesn't actually make logical sense, to blame the emergency room for outside factors that are influencing how people, like a diet and exercise or a pandemic, how much people need that resource.
So you've shared your very serious reservations about this executive order. This isn't the only barrier to actions on homelessness supported by evidence these days, is it?
It's not. There's also the Supreme Court ruling from last year called the Grants Pass ruling that allows communities to fine, ticket, and arrest people for simply not having a place to live, for living and sleeping in public.
And there's some communities that have done that after that Supreme Court decision.
Yes. Lots of communities have started to pass ordinances that criminalize people for being homeless.
So what I'm hearing is there are solutions to homelessness. The VA has proven that you can significantly reduce homelessness with housing plus services. But this executive order is moving in a very different direction. And meanwhile, communities are not necessarily investing in the kind of programs that you think work, but are instead criminalizing homelessness. Where does that leave your field, your advocacy, and all the work that you have been doing? How do you see the future?
I think that we have a lot of opportunity right now to shift some of our focus from the federal level to the state and local level, where homelessness is really addressed by state elected officials with funding that they have control over, as well as local elected officials who some are choosing to criminalize people for experiencing homelessness, but many are not. Many are doubling down on what works. So I think from our point of view, what we are encouraging communities and elected leaders to do is to be as strategic with the resources that they have as possible and to invest where they have control over their own money in housing and services that will end homelessness for people in their communities, because we know that when people are housed in communities, everybody feels safer and the community feels stronger for it. So that's our approach right now.
And Oliva, thank you so much for joining me, talking about these major issues in homelessness and the response to homelessness. And good luck with all your work.
Thank you so much for having me, Josh.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.